you. This is a great meeting. I'm Dr. Huawei from Huashan Hospital, Shanghai, China. And thanks for the nice invitation from Dr. Hassan. Today, I will talk about the neurosurgical resection of pineal region with the three-dimension exoscopy. As we all know, the pineal region tumor is quite challenging for us neurosurgeons. And since there are so many various types, pathological types of the pineal region, some are easier to get, but some are really challenging. And in the history of the neurosurgery, it's quite a difficult case and a difficult clinical practice for us neurosurgeons. And so for like germinoma, which is sensitive to radiotherapy, maybe we only need to do a biopsy. But still, there are so many pathological types of this total resection, like teratoma and anadoma, sinus tumor, and also many other tumors. But the first issue is we need to do the surgery to make a solid pathological confirmation. So here is the case is a 15-year-old boy, and this patient, you can see the tumor is so huge. It's originally from a pineal region, but it grows so fast, and the patient suffered a lot. But for this, it's quite challenging for us in the clinical practice. For this kind of tumor, if we go directly to the tumor, it's quite. I don't think the patient, the boy, could tolerate the surgery. So we discussed with the oncologist, and we use the chemotherapy for the patient first and shrink the tumor a little bit, and then we do the surgery. So the patient's AFP decreased a lot. So for this kind of pineal region tumor, it's quite challenging. And there are also some adjuvant therapy right now, but it is still ongoing in clinical trials. So for pineal region tumor, surgical resection is still very, very important. This is the summary of our pineal region tumor resection in our department. This is the distribution of the pathological types in general pineal region tumors here, and almost half are germ cell tumors, but also there's a lot of other tumors like neuroepithelial and solid fibroid tumors and other tumors. So you can see here, you can see these pathologies here. So the surgical resection is very, very important for pineal region tumors. So how we do this kind of challenging cases? This is the history of the pineal region tumor, and you can see here in the 1913. The first success of pineal region tumor via cross approach was tried. And also with the advance of microscopy, Popper approach become popular since 1966. And in 1997, the neuroendoscopy was introduced to the pineal region tumor resection right now. For us neurosurgeons, we can use microscope, endoscope, and also right now we have exoscope. When the exoscopy was introduced to our department, we were also confused. What kind of surgery would we choose for? We will use exoscope. So you can see here, this is Dr. Garni. He also joined this meeting, and you can see for this kind of patient, this is how we use microscopy. This is how we use endoscope. So endoscope has some advantage for this kind of patients, especially for the ergonomic part. And this is our paper last year. We use the pure endoscopic resection for the pineal region tumor with via head-up park bench position. So for this kind of pineal region tumor, the endoscope is also is very useful. But for clinical indication, we will choose relatively small tumors for the safety issue. And right now, Waiton exoscope is quite popular. First, the Dr. Birch from LA, he generated this exoscope for the dietetic purpose. And then the 3-dimension updated very quick. And then in 2014, the ICG Viton was generated. And right now we have the 3-dimension exoscope. And this is how we use the endoscope and the 3D exoscope in our OR. And this is also the what we do in our OR right now. The advantage is the images is very high quality. It's and it's kind of the advance of the scope is kind of a combination of microscope and endoscope. This is a paper from India group. They published they think the microscope is better than 3-dimension exoscope and also better than 2-dimension exoscope. And in China, a Chinese group from Tianjin, Professor Yue, he published his reported his experience on the giant acoustic neurosurgery resection with a 3-dimension exoscope. And also recently, a German group reported their experience on the spine surgery with a 3-dimension exoscope. This here is our experience on the 3-dimension exoscope for the pineal region tumor resection. This is the operation theater, how we distribute all the equipments and events here. This is, we also use the park bench approach, park bench position, which was similar to the endoscope cases as we reported previously. This is an incision. This is a bone flap. This case is a 18-year-old male. You can see here the tumor located on the posterior part of the surgical third ventricle. So for the approach selection, it's quite difficult. So after discussion for this kind of patient, we can use the endoscopic approach here, and also we can choose a 3-dimension and an exoscope. This is a surgical video. So because of time limitation, we just skipped it quickly. You can see this is the exoscope. We can see the after opening the we entered the pineal region. The tumor obviously here. This is a teratoma, and we could easily isolate, get a nice plane between the tumor and the normal brain. So the surgery is quite nice. You can see this is a typical teratoma. So for this kind of surgery, it's ergonomic for both patients and neurosurgeons. And for the dissection, I think most of us neurosurgeons would easily to handle this kind of dissection. And after remove of the tumor, we can have a thorough view of the third ventricle, and we can make sure the CSF was the obstructive hydrocephalus was relieved. So you can see the tumor is quite huge here. So we can remove the tumor totally, and then we can see the thorough view of the third ventricle. This is the anterior part. So the other case is a 19-year-old boy. He suffered from headache and unsteady walking for 1 month. And you can see here, the tumor was adhered to the left thalamus. So this is also quite a challenging case. So this is how we do the surgery here. First, we use the modified park bench approach and use the gravity assisted and also release of the CSF from the macula cister. And we can open the natural corridor from the infratentorial and supra cerebellum corridor without any retraction. And after open the endocrine membrane, we can also enter the pineal region. Here, you can see here, this is the vein system. For this kind of surgery, it's very important to protect the veins. And for endoscopic case, in the endoscopic paper, we discussed a lot about how to protect the cystic, the vein system. You can see here, because of the gravity assisted, the tumor came down naturally. So without any retraction, this is also the other advantage for this kind of surgery. You don't need to use retract a lot. The veins could naturally appear from the tumors, so it would be easier to protect the veins. So we do a biopsy first, and we send the tissues to do the rapid pathology. Since the tumor is the plane between the tumor and the normal brain is quite easy to get, so we peel the tumor, and when we wait for the pathology, we keep going with the tumor dissection. And the most of the blood supply coming from the bilateral PCA, branches of the PCA. So it's quite decent. It's not difficult to do a hemostasis. And the pathology shows it's a mixed germinoma. So we already dissect a lot. So we remove the tumor totally. So you can see the CSF coming out, and we get a nice plan. The tumor originated from the lateral wall of the third ventricle. So we debugging the tumor and keep going to get a nice plan, and then we could totally remove the tumor. So for us, most of our neurosurgeons, the exposure is quite important. The dissection is not that difficult. If we get a nice exposure, the surgery would becoming quite easy for us. So you can see for this kind of exoscopic case, this is quite ergonomic and easier. And we also with high quality images. Thalamus was also protected well. So we have some brief summary here. The most important issue is how to select the approaches. For this kind of tumor pulping approach, you can see here, the red part is difficult to get, and the green part is easy to get. So for the tumors invaded to the fourth ventricle, it would be difficult. It was easier for the pulping approach, but because of the blockade of the vein system, it would be difficult to get into the third ventricle, especially to the invasion to the third ventricle tumor. And for the cross approach, we can use this natural corridor. It would be easier to get into the third ventricle, even if it goes deep into the third ventricle. And but because of the blockade of the thalamus, and it would be difficult to get the brainstem, lower part of the brainstem, and also it would be difficult to hemostasis here. So for clinical application, it will be we need to select the approaches according to the invasion direction of the tumor. So here we summarized our 25 patients of pineal region tumor with a 3-dimension exoscope. And this is a whole summary of the images of the patients. And luckily, we got the paper accepted this year by the International Journal of Surgery. So finally, we did a small conclusion. The first, the 3D exoscope is good for the indicated tumor. especially for those tumors embedded in the posterior sort of ventricle. We use the modified park bench approach. It will be all ergonomic and easier to get. And 3D also has its advantage in education. It's an original purpose. And also in the last 3 years, you know, we all suffered from the COVID. And in the COVID, for some emergency cases, the microscopy, we have a mask ahead of your face. It's quite easy, difficult to do the microscopic manipulation. But for this kind of 3D exoscope, it's quite easier because you don't need, there is a distance between the equipment and the patient and also surgery. So this is quite easier for this kind of exoscopic cases. So it behavior quite good in spatial events. So this is quite important to know how to use 3D exoscope. That's all. Thank you. And welcome to Shanghai. Thank you, Dr. Hassan.
Thanks a lot, Professor Wee, for this excellent presentation. Is there any questions from panelists?
Hello.
Yes.
Nice talk. How do you decide whether you will go posterior intrahemispheric approach or supracerebellar approach for a pineal region? Is there any way you decide pre-operatively which approach you will select?
Yes, thank you. This is a very important question. This is one also what we discussed a lot in our papers. Actually, in the microscope era, we use the microscope a lot in previous years. Recently, we used exoscopy and endoscopy a lot, but we have a lot of experience here in our department, in our team. We did a lot of pineal region tumor resection, but recently we summarize a lot, and we think, according to our experience, we will to see how the tumor invited to the third ventricle or the fourth ventricle, the two directions, because for the microscope, when you use the pop-on approach, the tentorial, even you cut the tentorial, if the tumor is huge, it will be still blocked by the vein system, and also it's difficult to pull the tumor out from the contralateral side. So if the tumor is giant to the third ventricle invasion, especially in the posterior part of the third ventricle, we would strongly recommend the endoscopic or exoscope. And the endoscopy, because if it's too huge, it would be difficult to get in the first stage in the because of the high ICP. But for exoscope, because it's kind of a combination of microscopy and endoscopy, it's quite easy for this kind of challenging tumors. And if the tumor invited to the adequate to the fourth ventricle, so it would, even the tumor is located deep, it is still could be manipulated and to be resected on a microscope with the pop-on approach. So that's the indication here. That's also we want to highlight in this presentation. Thank you.
Do you preoperatively decide by the location of the vein whether to go supratentorial or to go infratentorial? Whether you use
Yes.
endoscope or...
Yes, the veins is a very important issue. And as we did, as I showed previously, because if the tumor invited to the posterior part of the third ventricle, the main issue we can consider is the vein, the blockade of the vein system. So that's how we choose the approaches here. Yes.
Thank you.
Thank you.